What is Takotsubo cardiomyopathy? Cardiomyopathy is simply a weakening of the heart muscle, and there can be many causes. Takotsubo's was first diagnosed in 1991 in Japan and is named after a Japanese octopus trap. Tako means octopus, and Tsubo means pot or trap, and the name comes from the shape that the left ventricle takes on during the disease process. Another name is apical ballooning syndrome. Soon after 1991, it began to emerge in the United States and is now seen worldwide. TC has a preference for women in their 60s with a recent stressful event. They usually present to the emergency room with chest pain or shortness of breath and are initially diagnosed with an MI or acute coronary syndrome. Stress is the cause, but exactly how is unclear. Echocardiography can play a significant role in the diagnosis and treatment of TC. Thankfully, it's transient and most people survive if they make it to the hospital. Although the mechanism of action is unknown, the new diagnosis of TC should have criteria for early diagnosis and treatment because it mimics other cardiac emergencies, it's life-threatening, and is now recognized worldwide. The patient who comes to the emergency room and is diagnosed quickly has the best outcome. The Mayo Clinic has devised clinical criteria for confirming the diagnosis of TC. So the typical patient would be a woman in their 60s, presents to the emergency room with chest pain, shortness of breath. On EKG, it would show that there was ST elevation or depression that would indicate an MI or acute coronary syndrome. The cardiac enzymes would also be elevated. At this time, they take her to the cath lab, where it would be discovered that she does not have any significant coronary disease. The hypokinesis of the left ventricle is transient, and it involves a large area of the heart muscle. If a ventriculogram was done during the cath, it would show this shape, which is the classic shape of the Takotsubo. Treatment is based on the level of cardiac dysfunction. With moderate dysfunction, medications are used to support the heart muscle. Most deaths occur from cardiogenic shock or systemic embolization, and this is where echo is valuable. It decides if the cause of shock is from severe LV dysfunction or left ventricular outflow tract obstruction. Echo can clearly see if it's an outflow tract obstruction. This obviously is an echo image of the left ventricle during the acute phase. It has the classic shape of the Takotsubo. This image here is 6 days later on the same patient with a complete resolution. As I said, the echo can see if there's a left ventricular outflow tract obstruction, and this is significant because it would affect the treatment. That patient would have to be put on a balloon pump because the medications used to help would actually worsen this condition. Echo can also see if there's a thrombus in the apex, and if there were, then the patient would have to be treated for stroke prevention as well. We know that stress causes TC, but we don't know how. The most recent studies indicate a super elevated level of catecholamines cause a toxic effect on the heart. A later study was actually identified specific proteins that are released by the injured myocytes. And this research is really significant because it can lead to blood tests that could diagnose TC earlier and also develop medications that could interrupt this cycle and prevent the patient from becoming critical. So there you have it, TC in a nutshell. We know that it looks like an MI or acute coronary syndrome. It usually affects most postmenopausal women after a significant stressor. Treatment is designed to support the LV function, and heart function improves in days to weeks with full recovery in months. We know all these facts because researchers around the world are studying their patients to learn more about the disease process. As a result, the Mayo Clinic has published clinical criteria to help physicians recognize this new cardiomyopathy and to treat them sooner. Some strides have been made in determining the exact cause, but further research is needed. Countries around the world are researching so that they can develop earlier means of diagnosis and treatment and prevent Takotsubo cardiomyopathy from developing into a critical event. If anyone has any questions, I'd be glad to answer them at this time.
What kinds of stress causes TC?
Well, that's a good question. It's usually severe emotional stress, a life-altering kind of a stress. like a divorce, a death in the family, job loss, those kinds of things. But they've also identified physical stressors that have caused it as well. They found it during dobutamine stress echo, narcotics withdrawal, and people undergoing intense physical exertion. They've also seen it develop in ICU patients that have no previous history of heart problems. Anything else?
How does the catecholamine level affect the heart?
Well, elevated levels of catecholamines actually make the heart beat faster and stronger. But it was found that super elevated levels are toxic to the heart muscle and cause it to be weaker and less efficient.
Can echo diagnose TC?
No, but it is valuable in confirming the diagnosis, in assisting with the diagnosis, I mean. Echo can see that they have the typical wall motion abnormalities of Takotsubo, and it also can help to see if treatment is being effective. Thank you very much. If you have any more questions, I'll be glad to answer them later, and I have my research paper you can read if you like, and other articles. Thank you very much.